This podcast episode is based on the book Eminence, the New Standard for Plastic Surgery Marketing by Jen Ahlsten, published by Vitruviani in 2026. Chapter 3: Credibility Forms Across Platforms. Patients researching plastic surgery providers often move across websites, Instagram profiles, review platforms, YouTube channels, and Google Maps listings, forming their impression of the practice from all of them combined. The cost of an inconsistent digital presence. The decision to contact a surgeon usually develops across several digital encounters. A patient who has spent 3 weeks investigating and comparing facelift surgeons may have visited a dozen websites, watched hours of surgical explanation videos, read reviews across RealSelf and Google, and saved before and after images to a folder on their phone. Across repeated encounters, the patient begins to form an impression of the practitioner. Investing in thoughtful and consistent presentation lets the practice control how it's perceived. A surgeon who recognizes this treats digital presentation as part of professional conduct. Digital presentation is also a tool to communicate what the surgeon behind the practice deeply values. A gallery presented with care suggests a practitioner who wants patients to see results as they truly are. Educational content that values transparency over persuasion implies that a surgeon believes their patients deserve to understand all the details of what they are considering. References to visual art suggest an approach to aesthetics rooted in proportion and harmony. Inconsistency across platforms communicates something about the practice's attention to detail, whether or not that was the intention. Picture a surgeon whose website presents them as a meticulous, academically oriented practitioner. The educational articles on the surgeon's website are extensive and combined with restrained design and professional photography. A patient browsing begins assuming that the surgeon is someone methodical and aesthetically sensitive. Then they visit the surgeon's Instagram and encounter several carelessly designed promotional posts, a time-limited discount on breast procedures, a giveaway offering a free consultation in exchange for tagging friends. The decision to book may feel riskier than it would have if the website and social media had been aligned to the same standard. On platform-specific content formats. In order to create a consistent and professional image, every patient engagement across platforms should feel like a progression of the same practice. A surgeon can absolutely be more clinically precise on their website and more conversational on social media without creating incongruence. But what must remain constant is the underlying set of values the practice keeps communicating. Keeping the platforms visually consistent helps all messaging look recognizable. Some content formats perform better on certain platforms than others. For instance, the content on the practice website and YouTube is ideally more comprehensive and long-form than the content on social media. There is evidence that social media marketing in plastic surgery influences patient interest and surgeon selection, especially when posts feature before and after results, patient experiences, recovery content, and educational information. Relying on engagement metrics alone is an incomplete strategy for determining the effectiveness of plastic surgery marketing. Despite the platform-specific trends that may reward shocking or entertainment-oriented content, there is currently no evidence that producing entertainment-based social media content improves patient acquisition and inquiry quality, even though a few surgeons might have built a large audience with entertainment-based content. Therefore, treating social media as a platform to communicate the practice's values, results, and approach to aesthetics remains the safest and most efficient strategy for most surgeons. Chapter 10 discusses social media advertising in more detail. The root cause of inconsistent digital presentation. Coherence across platforms requires applying a single standard across every patient-facing surface, but most practices have not based their marketing on internal brand guidelines that ensure that every member of the marketing production knows what rules to follow when creating marketing materials. Typically, plastic surgery marketing is assembled through separate service providers. A web agency builds the site, a social media manager handles posting, a photographer produces content, and a different provider manages ads or SEO. Each provider functions within its own scope, guided by its own assumptions about what works. When no one is responsible for how the pieces work together, the result becomes fragmented. Without a unifying standard, visual and tonal alignment are left to chance, and inconsistency emerges even when the service providers themselves are competent. The solution is to establish a detailed brand strategy for the practice, translated into internal guidelines that staff and external vendors can follow. Brand strategy establishes how the practice is positioned in its market, how it intends to be perceived, and how it communicates its values and reaches target patients. Brand guidelines operationalize it by defining visual and verbal communication tone in detail, enabling anyone to represent the brand accurately. The practice's website, social content, customer service, sales approach, and even review responses start to reinforce one another because they are governed by the same criteria. The next chapter discusses branding in greater detail. Social proof as risk reduction. Social proof reduces the anxiety of committing to surgery by grounding the decision in the experiences of previous patients. A collective positive experience serves as evidence that the decision is unlikely to be a mistake. Sustained consistency across many individual interactions, shown through reviews over time, can establish a kind of reliability that a single testimonial usually cannot. In a 2025 commercial patient survey of more than 1,000 US adults, 84% said they check online reviews before choosing a new healthcare provider. More than half, 51%, read at least 6 reviews before deciding. The same survey suggests online reviews can outweigh personal recommendations for many patients. In another 2024 survey, 72.71% of respondents considered online reviews when selecting a healthcare provider. The way a practice responds to reviews, especially to criticism, carries its own weight as well. A patient reading a critical review that has been sitting unanswered for months is left with 2 possible interpretations. The practice failed to notice, or it noticed and chose indifference. Research on online physician reviews suggests that physician responses can influence consumer evaluation and choice. A careful, non-defensive reply demonstrates attention, seriousness, and accountability. Silence can suggest the opposite. Third-party verification and borrowed credibility. A surgeon's website can explain their credentials and experience, but patients still understand that the surgeon controls how this information is presented. Third party mentions matter because they suggest that the surgeon's reputation exists beyond the practice's own marketing. A publication feature, institutional affiliation, collaboration with a respected practitioner, quoted comment in a serious outlet, or speaking role at a professional event give the patient another reason to trust the practice beyond its own claims. Credible external validation can suggest that the surgeon's reputation has been recognized outside the practice's own channels. Patients understand that recognized publications, institutions, and professional events do not feature everyone equally. When a surgeon appears in those contexts, the patient sees the practitioner in relation to people and organizations that already carry authority. Affiliations work in the same way. Membership in a professional society, privileges at a respected hospital, conference participation, research work, and visible collaboration with established clinicians place the surgeon inside a wider professional structure. A joint educational video, panel discussion, co-authored publication, or other visible relationship suggest that the surgeon belongs to a credible professional community. Eminence is available on Amazon and at Vitruviani.com. Next, Chapter 4, Branding as the Foundation of Effective Plastic Surgery Marketing.